and we're looking forward to many, many more. Happy birthday, GHC.
Happy 5th birthday, wishing you many more.
Global Health Corps is a leadership development and placement program for a new generation of global health leaders. We place young professionals from around the world within global health organizations which are looking for creative thinking and innovative solutions. As a community, we are a group of people who share a common belief that health is a human right. Everyone deserves access to affordable and quality health care information and services. We also believe that everybody has a role to play in advancing social justice through the health equity movement. That is why you'll see that we bring in people from different walks of life to play their different roles in this movement.
I mean, this is a really, really unique organization. It's a really unique opportunity, pairing a Ugandan fellow with an American fellow, bringing those ideas together, bridging that cultural divide, really learning to understand one another, and coming up with really innovative solutions because of it. And I think Global Health Corps has a great model, and I think it just needs to keep doing that.
It's really incredible to be a part of a network where we feel so supported, where I have 30 built-in friends who sort of have the same values as me, as different as we might be.
Global Health Corps started in 2009. And for that year, we had fellows placed in Rwanda, Burundi, Malawi, Tanzania, and the US. Our first class in Uganda was in 2010, 2011, and we had just one placement organization, and that was Infectious Diseases Institute. We placed 4 fellows in that organization. We had 2 people doing distance learning, and then 2 people doing monitoring and evaluation.
As a fellow, I worked with Access Project. This Access Project uses a business management model of improving health systems. We know that the health facilities have funds, but how do they manage them? So if a fellow of GHC comes in, because I come from a finance background, put my knowledge into health sector, improve them, give them, share with them my knowledge, share with them my experience, and make sure that the funds that are received are well used. It's an achievement for myself, but also for GHC that gave that opportunity, because there are more talented guys outside here, but some of them don't get the chance. But GHC comes, gets that opportunity, gives you that opportunity for you to shine.
In celebrating the 5 years, all the 23 placement organizations that we've ever had, we're expecting to have our alumni, all the people who've gone through our program have been invited. We're expecting to have all our fellows, the current fellows, we have total 30, so they will all be there. Peer organizations are friends, so we'll have people like Building Tomorrow, which is another fellowship program, Princeton Africa. We'll have people from Peace Corps. We're hoping to have the ambassador, the US ambassador to Uganda, Scott Delis.
Organizations like the Global Health Corps, where we bring together partners from the United States and from host countries like Uganda or Malawi or wherever it may be in the world, are incredibly important. We need the committed effort of so many actors to really make a difference in people's lives, to touch their lives in a positive way and bring about these changes. And I think that when we see young volunteers and fellows like we do in the Global Health Corps program, not only do they have an impact for today, they're going to have an impact for tomorrow.
In 2011-2012, we increased our number of placements to 6, and so we added Mpoma Community HIV/AIDS Initiative, which is a small community-based organization in Mukono, where we had 1 fellow working on health and another fellow managing the school program. We also added CHAI, which is Clinton Health Access Initiative, where we had 2 fellows working on supply chain, medicines and working with the Ministry of Health.
As a Clinton Health Access Initiative, and I think overall I could say my experience was amazing. I had a good co-fellow. I actually got to make some really good friends from the fellowship, who I'm actually still in contact with up to now. And even the role that I was having at the organization, I was able to sort of continue that even post GHC. I was working as an analyst for a diarrhea treatment program and scaling up treatment in public health facilities. And post that, I have been able to sort of increase my scope of work and also engage more with the ministry. And I think on top of the organization experience that you get, it's the multicultural environment that is really unique.
We added EGPAF, Elizabeth Glazer Pediatric HIV/AIDS Foundation in Barara, where we had fellows working on antenatal and postnatal care and making sure that mothers did not pass on HIV to their unborn children.
I applied for GHC in the 2012-2013 year, and I was late. And so I determined that I would apply the following year. So it stayed on my calendar for over a year, just waiting for me to open up to the next application time. And the real inspiration was from a former GHC fellow who was a good friend of mine, Nagis Shiraz, who worked with Millennium Villages in Barara. She really inspired me to keep applying until I got the fellowship.
We also added Action Africa Help International, which is an organization working in a refugee settlement area in Changwale, where they were mainly doing health education and helping the refugees and the communities around that place to have better health. The other placement that we added that year was Millennium Villages Project, which is in Barara, in Ruhira, where fellows were mainly working on HIV, TB prevention, and doing a lot of analysis of data to make sure that MVP was monitoring its progress and growing effectively.
Happy 5th birthday, GHC. It's an amazing opportunity. And you have so many change makers to be. Happy 5th birthday, GHC. Cheers, GHC.
In 2012-2013, we added Mifumi Project, which is an organization that addresses domestic violence and making sure that these women get health care, free legal services. So we placed fellows in there. We also had Strengthening Decentralization for Sustainability, USAID project that was supporting the Western region to make sure that they did not duplicate services. We also added another small organization called Action for Community Development, and that one is in Kasese. And here fellows did mainly fundraising, communications, and they worked a lot with the communities. We had fellows in Fort Portal, Management Sciences for Health.
I think the party was amazing and celebrating 5 years, and there's been so much success in that 5 years, starting from just an idea that Barbara Bush and her co-founders had to where we are today with 128 fellows in the field in Africa and the United States. I think is a huge achievement and a landmark experience to be a part of.
In 2013-2014, we added 3 new partners. We added Reach Out to Mbuya, which really focuses on treating, managing HIV. And then we also added another USAID project, which is called Assist. It's also dealing with HIV cases. We also added Reproductive Health Uganda, where fellows were mainly doing, one fellow was in administration, the other one was doing quality assurance. In 2014-2015, again we grew our number of placements. We added non-communicable diseases, which was a new area for us. We also added Joint Clinical Research Center.
The famous group MediaRush just sang a birthday song. Those are fellows at the Joint Clinical Research Center.
Soul Foundation, which is a small organization in Jinja.
My placement organization, Soul Foundation, we just celebrated our 5 years last Saturday. So the two organizations are really moving, at the exact same speed, and we've been around the exact same amount of time, and having this partnership is really great. And I think 5 years is a really key benchmark. It's when you can really look back on how you've progressed over the last, the nascent stages of being an organization. I think it's a really good time for reflection, kind of seeing what you could be doing differently moving forward in the next 5 years.
Nyaka AIDS Orphans Project, which is in Kanungu, and Japaigo, which is in Kampala here.
For us, I think GHC marking 5 years helps to sort of set the tone for what is it that we want to be about in Uganda. So for here in our organization, we're helping to train midwives and to help improve the way that women are serviced in their respective health centers all around the country. And so GHC marking 5 years is part of that story. It's part of that movement that Uganda is part of, that Uganda is striving to work in, and GHC partners along with these organizations and to be able to achieve those goals. And so marking 5 years is to say we're doing these things, we're continuing to be committed to those things, and we're going to continue to move forward in those.
After GHC, we are given a one-year contract with our placement organization. So within that year, GHC still prepares you for a transition where you look out for other jobs. Others choose to go to school, others choose to look for other jobs. So with me, I read papers and I found a job at IDI that I was comfortable with, and I applied and IDI took me up.
I see health problems as my own, and that everyone has a right to access health services. After GHC, I have also taken on development in my professional life. Right now I'm doing my master's in public health. But because of the empowerment and the courage that I got from GHC, I see myself moving ahead and ahead to accomplish greater and greater tasks. The work that I did in GHC while I was placed with Dosha Mbuya was an M&E role. It's the same role that I'm playing this side, though at a bigger level, as part of a fellowship program that was fighting for health equity. Right now, as I work, I have it at the back of my mind than prior to joining GHC. Initially, I would just work. I would not know whether health equity meant anything or whether I had a purpose in life. But right now in my work, as I serve the communities I work for in World Vision, I have the background of health equity and I fight to continue my movement.
Yeah, one of the things that GHC has achieved in the last 5 years is a very strong alumni program. And Uganda happens to have one of the largest alumni programs throughout
we have the biggest class.
The global operations for GHC. So we're very excited about that. And what the alumni program does is it creates a platform for over 30 fellows every year to continue what we've been doing in fellowship placements, out of fellowship placements, into new workplaces, and into completely new communities. And I think I cannot thank GHC enough for realizing that it's one thing to start a conversation about young people who are passionate about health. It's another thing to keep the conversation going.
Yeah.
And the alumni program does exactly that. And GHC has committed funds and time and management hours to just craft this program where we continue even after the fellowship to be part of the movement for health equity.
So we have already in place an alumni program with a committee, with workshops planned. We continue developing their leadership skills and giving them access to tools and developing them as leaders moving forward. When we are doing their exit retreat, we introduce them to this program. After the fellowship, there is the alumni program. So Uganda happens to be one of the bigger alumni where we have like more alumni than in other countries. We grow and retain some of the Americans.
Thank you, GHC, for all that you do. And thank you to all of the partner organizations here today, because it wouldn't be possible without you. So once again, thank you to everyone for this shared effort that we make. And happy birthday, GHC. We're looking for many, many more years from you. Thank you all.